Into Red Room, how are you? It's Tony. So I'm going to do a quick video of the updated wellness stash that I have. I showed you guys a wellness stash that I built, and then I was just letting you guys know some of the gaps that I was filling in there. So this is kind of everything that I ended up getting again. Not really that much, but I just wanted to show you guys since I did do a video for that. Yeah, I didn't get to order from Bouquet Wellness or anything like that. I might do that later on in the season, but you know, there's that. So it's pretty quick. Most of it centers around immunity, health, and vitamin supplements and shit like that. So we'll just get into it. The cold stuff I ended up getting from the dollar store. Most of this is from the dollar store. Because it's just cheaper, and to be honest, it's just as effective. And like, having worked in the pharmacy, the pharmacist basically always just recommended people just go to the dollar store for a lot of the stuff. Like, they were just like, it's not that serious, it's not that deep for like cold stuff. Most of it you could get from the Dollar Tree. So anyway, ended up getting non-drowsy daytime cold and flu, which is acetaminophen, for the pain reliever, and then yeah, all this other stuff that I can't pronounce because I like stopped pronouncing words. But essentially, I wanted to get a non-drowsy formula because I do like to stay awake during the day, even though I'm sick, because it will just going to sleep during the day outside of a nap. Because when you're sick, it's a totally different kind of sleep that you're doing. It's like very deep sleep so that your body can like rest and recuperate kind of thing. But if you're doing that a lot, then it kind of messes up your nighttime, because then you're up a lot at night, and then it's just like a lot, you know, every night. So the non-drowsy daytime formula is what I prefer across brands. It doesn't matter what brand I'm getting. And then I got the nighttime cold and flu, which is acetaminophen, and so and the same ingredients, -1 on here. So yeah, the nighttime one, cold and flu, and then they're both just caps and stuff like that. So you can get like the bigger size, the packs and things like that. I just decided to get 10 each because respiratory ailments are my main wheelhouse of illness, essentially. Like anywhere like throat, sinuses, that's more of where I have a lot of like sickness. And so it's very unfortunate, but that's kind of how I deal with it. Okay, don't have the bottle. Ended up getting just some acetaminophen, helping myself to that when my head hurts and stuff like that. So I just get acetaminophen. You can get this valued, you know, Dollar Tree, Dollar General, Family Dollar, wherever you're gonna get it. You can also get it at places like Target, wherever you shop. But I just got this. It's the cheapest. It's really the cheapest, like $1.25. Ibuprofen also. Right. And then back on the cold things, explicitly the cold things. This is adult tussin, cough and chest congestion. And I just got this dollar store as well. When I was younger, I had to get the brown little amber bottles with like the medicine that they had to mix up and push it. I was like, oh my god. So yeah, I just get this. And usually I try to do the holistic stuff first, and if that doesn't work, then I go into the like serious, you know, I feel like this is a serious stuff like this. And usually if I'm not progressing within like 2 days, I'll go ahead and switch. Then I have some cough drops. I literally will go through a lot of these depending on how bad it is with my chest and how much I need to like soothe myself. So I just got a pack of these. I don't know if I need any more. We'll see. We'll see. Cool. Then some more immunity type things. I got the Wooden Spoon Herbs Lemon Ginger Immune Toddy. I forget where I got this from. I think I got it from like Mom's, I think. Moms, or yeah, I think it's Moms from there. And then I ended up getting Emergency, which is 1,000 milligrams vitamin C daily immune support, and I just got one pack. I haven't tried this yet, so I want to try this one. Yes. Little things that are not really related. I got some fabric bandages. I am interested in getting the Welly kit and getting gauze and bumping up my gauze and stuff like that, because I have hidradenitis, and I've had 3 major kind of lesions this year around my midline, actually, and I think it's kind of the irritation from the pants midline. Rubbed there, and then it caused quite a bit of pain. One was like the size of my fist, pretty much, on my skin. Just think about that, pulling and pulling and pulling. And so I needed more than this, but I just get these just in case I have like cuts that are in places where I don't want them to get irritated or get exposed to any nasty like bacteria and stuff like that. So those. And then I got these saline premix packets. Sinus washing may help with symptoms of nasal congestion and dryness. I've never really tried a lot of saline. Yeah, so that's kind of that. You're supposed to get the bottle, and I did not. I did not do that. And so I just decided to get this because I do tend to have, like I said, sinus issues, respiratory issues are my thing. So anything that helps kind of clean that up, clear that out, I'm down to try at least once. So got that. And then the last 5 things are just supplements. So I decided to get some supplements because I felt like with the decreased sunlight, it's getting darker earlier. There's just a propensity to feel lethargic, a little bit depressed, moodiness, and stuff like that. And I feel like diet will help, but we all need probably some supplementation during the darker months of the year. So I decided to get some things, and I just anticipate a little bit of deficiency. I'm going to be honest. I'm going to do these 2 first. So these are more like for the immunity thing. So I got this Mega Food elderberry immune support, 400 milligrams of elderberry per serving. And then it's a source of zinc as well. So I just got these with the gummies. And so, yeah, try these. I got some zinc lozenges also because immune support. I did take these before. Not this brand, but this is the 365 brand from Whole Foods. These are both from Whole Foods. But I wanted to just bump up my ability for immunity. As you can tell, I'm just really big on the immunity part. It's just respiratory. It's just my thing. It's just, I know it's my thing. I used to live with a smoker, so that was also a thing. And then I am taking medication now. When I look at it, it's just like this area also is kind of like stuffed. But it's not really irritation. It's like it's a literal side effect of one of my medications. So it's kind of like Lastly, I got 3 things from Trader Joe's. So I got vitamin D, which is 25 micrograms. And so, like I said, anticipating lack of sunlight being an issue, because you know it can affect your mood and stuff like that, in addition to bone health and stuff like that. I live in the Mid-Atlantic, and it's just definitely one of those things. So there's that. Next up, some omega-3 fatty acid daily supplements, 60 milligrams total EPA DHA per serving. So I got these as well, because I also don't eat like seafood, which is a good source of stuff like this, omega fatty acids. I gotta look up other things for this. And then B6, B12. B6 folic acid, B12, there you go. So I decided to get this just as a supplement. I'm not particularly pressed about it or anything like that. I just decided to throw it in there. I do still have the multivitamin upstairs. I think it's still good until next year, but I want to just start trying to use these because, again, supplement health is just very important, and I really want to like try my hand at doing things that are necessary for that to like be well. Yeah, so that's everything that I'm adding to the wellness cabinet, so to speak. And then again, you already see the other part that I have showed you with what I currently had, what I had before I got all this stuff. So that's about it. Anything else in terms of, I think the only thing that I will say is that I'm going to start looking into, I guess, the minerals and vitamins that we use and take in our bodies and the best ways to absorb them, and then kind of build a wellness routine out of that. Because when you get these things, like, people just take them, and then some are like water soluble, some are fat soluble, some like work better if you take them together, versus like some are like, don't do this, don't take them together, take one after the other 2 hours away. Like, if you're taking calcium, don't take this, if you're taking this, don't take that, you know. So learning about those things, like, these are not things that you learn, but learning about that would be helpful, and then incorporating that into how you consume your food would kind of help with that. So that's what I'm aiming to do for my cooking. Anyway, thanks for watching. I'll talk to you guys later. Bye.